Hello, I'm Shane Plymell, president of Shannon, and I'm actually here with Dr. Doug Schultz, who is a pediatrician, but also is one of our chief medical officers. And we have some exciting news: is the vaccine has been approved for children. And can you talk a little bit about what age groups can actually get the COVID vaccine now?
Yes, the FDA and the CDC just approved age 5 years to 11 can now get the vaccine. Of course, 12 and up could already get it. So that's a whole new group of people now that is pretty exciting.
Now, is it all three vaccines, or is it, of all the, there's three vaccines available today, so can you get, can we use all three of them on children, or is it?
No, this one is only approved for Pfizer at this point. The others are applying, but they haven't got all the way through the process. So it's only Pfizer's approved for kids 5 to 11 at this time.
Why are they just now recommending vaccine for those age groups?
Good question. The reason is they had to study this in children over time, make sure number one, it worked, which it does. It's like 91% effective in preventing COVID in children of that age group. And it turned out to be extremely safe as well. So that allowed them to go ahead and approve it and be confident that it will work.
So you're pretty comfortable with the study, right?
The study was in a large number of children, and yeah, we're very comfortable. The data was great. So yeah, it's the same exact vaccine that adults get. So we know how it works, and it is 1/3 the dose. So it's a smaller dose, and it's a smaller needle too. So
that's good.
Kids will like that, of course.
Doug, I got a question to ask you about side effects. Is the side effects the same for children as it is for adults?
Yeah, the side effects are in general the same. Sore arm, you can feel a little bit bad the next day for a 24-hour period, and then you're back to normal. There have been some rare side effects. One of them is called myocarditis. This is an inflammation around the heart or the muscle of the heart. It's in young people, and I mean teenagers, 18, young 20s, small numbers, but it definitely did happen. Most of them did great, lasted for a brief few days, and they got better. So it is a serious side effect, but it did improve. The children in the study did not have any myocarditis, so far it has not affected them. And so we aren't really too concerned about that at this point.
So if I'm a parent, and I have kids in this age group, how do I explain to them what the vaccine's all about?
Yeah, I think the best way is, kids, around 8,000 kids got COVID and were in the hospital this past COVID season, and over 700 of them died. So it's a serious thing for kids, and so you don't necessarily tell the children that, but this vaccine is to protect you from getting sick. That would be the simple message.
If I want to get my children vaccinated, what would be where can I go? What's the process?
Yeah, we're going to start giving this vaccine this coming Monday in our vaccine clinic, which is on Knickerbocker Street at the South Shannon campus. That's where we'll do Monday through Friday. This walk-in. You can also make an appointment, but you don't need to. You can walk in with your child, and if they're in this age group, they can get the Pfizer vaccine.
So they don't need no appointment. They can walk in.
No, they don't need an appointment.
Okay.
They will need a repeat dose 3 weeks later, just like the adults did. So they might want to make an appointment to come back in 3 weeks, just as a reminder. But they could come back, and walk in 3 weeks later too. So it's supposed to be easy.
So you have grandchildren, correct?
I do have 5 grandchildren.
So what would be your recommendation to your family?
Yeah, my recommendation is a strong recommendation to get the vaccine, because I don't want to see my grandkids end up in the hospital or worse with this COVID.
And I have 2 boys, and both my boys have been vaccinated, so
yeah.
I'm glad for that. So
it's a good thing to do, and very safe. It's again the same technology, same RNA technology, which is very effective yet very safe, which is awesome.
And we're getting right up here on the holiday season, so you're going to have a lot of interaction with, you know, parents and kids and also grandparents. So it's just another way to keep everybody safe.
Oh, that's a great point, because if the kids do get COVID, they of course don't always end up in the hospital, but they would spread to older people who maybe aren't vaccinated or have underlying conditions. So about 3 weeks after the first vaccine, they should be, you know, fairly immune, which would bring us to the holidays.
Well, we're super excited about having the vaccine available for this new age group, and please, when you have a chance, come see us on Knickerbocker, and hopefully we'll get your children vaccinated.
Sure.
Thank you, Doug, for joining me today. And
My pleasure.